Hello, good morning to all of you. In this video, I am going to reveal certain real truths and some secrets about weight loss. Why people lose weight differentially? Why not all people can lose their weight? What is the science behind overweight or obesity? Why there are so many dietary formulas available and which diet among all these is the best one? So these are certain nagging questions which plague the minds of the patients and people and the public and some doctors universally. So I try to analyze my own experience, my knowledge to answer certain important secrets and real truths about why weight and how to lose the weight and what to be done in an individual person about weight loss. So to start with, see, overweight is not a disease per se on its own. Remember, overweight or obesity is a fertile ground on which the seeds for other diseases are sown, such as diabetes, hypertension, thyroid disease, osteoarthritis, bone disorders, depression, and body image disorders. So, overweight or obesity is not a disease on its own. It is a ground on which it forms a platform or foundations for many other diseases. So one has to correct it for all-round health. So here I compile some 9 important vital points or secrets about the science of weight and weight loss. So this video is about the science of weight and weight loss. So the first point is, see, every individual has a set point in our brain or hypothalamus. This set point or set level is specific for that particular person. This set point for weight or weight loss is dependent upon their genes, their family background, also called as constitutional obesity, and also it depends on their hormonal status. So it is specified. In other words, it can also be called as an unmodifiable factor. See, there are two things, modifiable and unmodifiable factors. Unmodifiable are based on the genes and the hormone environment. The modifiable factors are acquired by the habits and lifestyle from the society, or in other words, related to the occupation. So, suppose a person has the set level of 80 kgs body weight. That person, in spite of all the efforts, it's very difficult for him to lose weight to get below 80 kgs. Suppose if he is 100 kgs now, suppose the set level is 80 kgs. In spite of the best efforts, he can come up to 80 kgs. He cannot become 79 kgs or 78 kgs. Even if he achieves that below 80 kgs, it will be transient. Again, it reverses back to 80 kgs. This is called set level point. Okay. For example, being a metabolic surgeon and surgical endocrinologist, we resort to metabolic surgery or bariatric surgery for some obesity patients, over obesity patients. In those patients, the main thing which the bariatric surgery does is it decreases the set level point in the brain to lower level. For example, say from 100 kgs to 70 kgs. Then only we can achieve that. It's just like setting our goal. Suppose if a student is studying for their exam, if he sets a timetable and also a goal, then only he can achieve it. Similarly, there is an inner set point for the weight. So it's very difficult for a person to change that set level. The only way in which we can change the set level is through bariatric surgery. That is one way. Now coming to the second point, there is also, for a given individual, there is something called a range of weight. That's minimum to maximum. For example, just like blood pressure or the temperature. Similarly, a person has say 70 kgs to 90 kgs is the range of his weight. That is a normal weight. So he keeps on fluctuating between these two levels. If he overeats or if he resorts to sedentary lifestyle, he will go up to 90 kgs. And if he is very strict with his diet and exercise, he can go up to 70 kgs. That's the minimum. So going beyond this range, set range for that individual causes the diseases. So if he grows more than 90 kgs, it can be called as overweight or obesity, which leads to all other diseases. If he goes below 70 kgs, it becomes underweight and also leads to nutritional deficiencies. So this range is also another important scientific fact behind weight. Coming to the third point. Whenever a person wants to lose weight, remember it starts here with his willpower and trust, self-trust. Even if the willpower is less than 100%, then it's very difficult to lose weight. In spite of all the efforts, medications, diet and exercise, willpower and trust is very important. Trust on himself and trust on the doctor. And another important point related to this one is, do not compare yourself with others' weight. That's very important, because we can compare for other aspects, for say professional achievements or other points, but not with regards to body image and weight. Because if we starts comparing with others, it impacts negatively our mind. So comparison is not encouraged. Now coming to fourth point. Most people, unfortunately, follow quacks. The advice of quacks are unqualified people or non-doctors. The remedies suggested by these quacks. Instead of following doctors, especially the endocrinologists or the dietitians. One of the reason is here again the psychology plays, because these quacks or unqualified people tend to give fake promises. They also say that you will get 100% weight loss and cure, and you can be free of this excess weight. But as a doctors, we don't promise 100% cure. The reason is we know the science behind that. Because any hasty steps or shortcuts will lead to a lot of problems. Remember, there is no shortcuts for success. Similarly, there is no shortcuts to weight loss. We should have an enduring, long-standing, patient approach with a disciplined and a planned approach for weight loss, which constitutes of diet, exercise and certain medications based on the qualified doctor's advice only, not on the quacks. The quack remedies are very dangerous sometimes. Now coming to the fifth point. See, again, there is no single magic remedy for all. There is no universal magical remedy for weight loss. The treatment or the approach should be individualized, tailor-made or custom-made to the particular individual. That's the reason why everyone has to, if at all he wants to lose weight, he has to consult a qualified physician doctor, preferably endocrinologist, with dietitian support for weight loss journey, which consists of a balanced approach of lifestyle modification, dietary habits, certain specific exercise, which again varies from individual to individual based on their occupation, based on their age, whether they're from rural side or urban side. So in general, there are some general instructions for all with regards to diet and exercise, with specific tips which is individualized and tailor-made to the individual. Coming to the sixth point. Many people nowadays are following certain magic remedies created by quacks such as Herbalife. They are very harmful because the side effects such as kidney damage, liver damage, they resort to some adulteration that leads to several problems. Sometimes they are life-threatening. These casualties are not reported or highlighted in public or in advertisements. But some of these remedies or magic dietary regimens have short-term dramatic impact, but they are very dangerous. So please beware and be away from dietary remedies such as Herbalife, which is very dangerous. Follow doctor prescribed medications and diet and get evaluated properly. The seventh point is, see, first is setting a target or goal. That's very important point. Then enjoy the process of, not the goal. Forget, once you set the goal or target of how much weight to be lost, then enjoy the process of this diet, exercise and other medications. Also, as a doctor, we tend to evaluate the hormonal environment, and if at all there is any hormonal disorder underlying which is the cause for weight, we correct it with some medications. So, such as thyroid or PCOD or diabetes or cholesterol problems, these have to be corrected. Without that, it's very difficult to lose weight. So the focus and enjoy the process rather than thinking about it, the goal, the entire day. Coming to the eighth point. So remember, in my experience, almost 80 to 90% have lost significant weight. Especially those who religiously followed my diet, exercise and the lifestyle. Those who don't follow, it's very difficult to lose weight. But those who have followed, 90% have achieved significant weight loss to their satisfactory level, to my satisfactory level, and they got rid of many diseases. Sometimes even the diabetes can be cured, thyroid has been cured, asthma has been cured, hypertension has been cured with weight loss. So they can get rid of many medications with just weight loss. Now, finally, the ninth point is, now I am going to give you certain golden secret tips for weight loss. So the key golden tips to lose weight is weight. That is WEIGHT. Means W means wait. That is WAIT. Wait for the time. Don't hurry up. You have to set target of 6 months, 1 year or 2 years. Don't hurry up for weight loss. Otherwise, if you do it hurriedly, two problems can occur. You tend to fall into the trap of fads and some diet regimens like Herbalife, and also you can tend to, even if suddenly weight loss is done, the skin will be sagging and you look very old or diseased. So there should be uniform reduction of the body all round. For that, you need to be enduring and long-standing planned approach, balanced approach is mandatory. So weight, that is first one. The second is E. E for follow the above 8. I means ignite the desire, the goal. Ignite the fire in you to reach your goal of weight loss. That's important point. Without that, it's very difficult. Coming to the G in weight. So G means gait. G-A-I-T. Gait means walking. So indirectly I'm hinting about exercise. Calorie burning exercise. Depending on the age, one needs to burn the calories. The exercise again varies from occupation and age to age. Especially fast walking or jogging exercise or playing sports, such as they are prescribed from individual to individual. Again, coming to H for height. This is especially important in children, because those who tend to be overweight, the children, they gain lesser weight, the final height. So that's the reason why it's very important to lose weight in pediatric obesity to achieve good height in the long run. Coming to T in weight. T for tight. Be tight on your diet, schedule, exercise. Finally, in the surgery, that is bariatric or metabolic surgery, is the last option. Remember, in spite of trying all the above things, diet, exercise and lifestyle modification and some medications, if the satisfactory weight loss is not there, especially with the associated other problems and diseases, then only we resort to metabolic surgery or bariatric surgery. It's a last option, because the bariatric surgery also has got its own problems. It has to be tailor-made to particular individual. Not all are deserving candidates or ideal candidates for metabolic surgery. So in summary, These are the top secrets about weight loss. In subsequent videos, I will cover more about this. And for now in this video, kindly like, share, subscribe for more outreach and for knowledge to you and to your friends, family and society. Thank you. All the best.